All right, so hello everyone, and welcome to another one of the American Physician Scientist Association's interactive sessions. Tonight we're finishing up our PSTP week with a really exciting session, Pediatric PSTP Pathways. This entire past week, we've been featuring specialty-specific conversations with PSTP residency program directors. And tonight we'll feature representatives of pediatric PSTPs. We can get started with some quick introductions from our panelists who've graciously agreed to join us tonight, despite their very busy schedules. Um, if you'd like to say your name, role, and institution that you're representing, we can go ahead and get started. Dr. Satlin.
Sure. So welcome to all of those who are attending. I'm really excited that you're all interested in pediatrics. I am a pediatric nephrologist. I am the chair of pediatrics at Mount Sinai in New York City. I still run a lab. I love science. I study the ontogeny and mechanoregulation of ion channels and secretory epithelia. I am the chair of the board of directors of APSA, a previous MSTP director. So I am totally committed to this pathway. So shall I just say Dan next? Move it along. Yeah.
I'm Dan Moore. I'm the director of the Physician Scientist Training Program at Vanderbilt and a pediatric endocrinologist. I'm also the chair of the National Pediatrician Scientist Collaborative Work Group, which is a group of about 20 programs that all have PSTPs that get together to think about curriculum and advocacy and how best to get you guys from point A to point B, whatever point A's and B's mean along the way to research. I'm a pediatric endocrinologist. My research areas, diabetes immunology and preventive therapies and clinical trials, translational studies, and some animal models.
Okay, I'll just jump in. Hi, everyone. My name is Ann Chahroudi. I am at Emory University and Children's Healthcare of Atlanta. I'm a professor of pediatric infectious diseases. I do a lot of translational research on HIV and other exciting viruses. I lead we call it the PRIZE program, our research and residency program here, and am the strategy and operations officer for the Society for Pediatric Research. And we're very excited to talk to you all tonight. As you have heard, we're all passionate about physician science and pediatrician scientists. So we're hoping to recruit you all to join our field.
Wonderful. And I'll introduce myself. My name's Tuba Rashid. I'm your moderator for this evening. I'm also a rising fifth year MD PhD student at the University of North Carolina at Chapel Hill. Helping me behind the scenes are Carrie Davidson, who'll be managing the chat and logistics for tonight, and Jonathan Sanchez, who'll be live tweeting highlights from our conversation. And a quick housekeeping note, if you need to step away for any moment, don't worry. The session is being recorded and be available after on our YouTube page. For tonight, we'll be starting with brief presentations from our speakers about training pathways for pediatrics. And then around 7:30, we'll create some breakout rooms so that you can get kind of time to connect directly with our panelists and ask questions there. And I believe we're going to start the presentations off with Dr. Moore.
Yeah, I think we've broken it up. I'm going to talk a little bit about ARP and IRP, sort of the on-ramping for some of the physician scientist development. Dr. Tree is going to talk about the R38 programs, which can accelerate research for people with all kinds of different backgrounds. And Dr. Satlin's going to talk about the PSDP program, which usually starts to appear in fellowships. So we'll hopefully have a good sequence here to get you oriented to some of the training pathways that you can pursue. If you were here last week for peds and derm together, I may say a lot of the same things. So, you can sleep through this part if you heard that last week. So if you're going to become a pediatrician and scientist, there's a lot of different ways to become a pediatrician scientist or physician scientist in general. You may have already been in an MD PhD program, or you may have had an MD experience. You may have had some research as part of that experience, or you may not yet have had a lot of research experience. You may continue on to residency, where you, again, can accumulate research experience, such as through the R38, or you may accumulate more clinical experience. At some point, you may become inspired by something that you see in the clinic or something that you encounter during your training. You might decide that problem needs your hands-on to answer it. Often that occurs in fellowship, and you may extend your fellowship or expand it to include research components there. Even afterwards, as you become a full-time clinician, you may encounter something that really inspires you, or you may become a full-time researcher that then adds different elements of clinic and clinical research to your portfolio. So there's a lot of different ways to combine this. And I think PEDS, more than any other specialty, has done a wonderful job of being open to these many different pathways and experiences that can lead to science. Certainly pediatrics needs a lot more scientists, but I think we also need to be welcoming of all kinds of different perspectives, viewpoints, and sort of training pathways to get from the beginning through the curiosity and out to the actual executable research at the end. So PEDS is a wonderful place to do this. If you think you'd like to have research as part of your life and you like small people, that's great. It's part of the pediatrics mission as dedicated by the ACGME, like intrinsic to the discipline or scientific knowledge, the scientific model of problem solving and evidence-based medicine. And of course, all diseases begin in childhood. So if you do anything else, you're just arriving late to the mechanism anyway. So you should just be a pediatrician if you're curious about science. The overarching structure in which your scientific training takes place is in a standard residency program. So let's talk briefly about the base. So the base model, categorical pediatric training, is a 3-year residency program. And the focus of residency programs are on clinical training, inpatient care, outpatient care, exposure to the subspecialties, integration across specialties, and learning all the things you need to be a pediatrician. On completion of that, you might be able to practice general pediatrics or continue on to fellowships. Fellowships in pediatrics are mostly 2 to 3 years. A few linger into the 4-year area. A few are 2 years, but most are 3-year specialties. And in those specialties, most of them have 18 to 24 months of research time. So pediatrics has remained a very strong focus in the fellowship on providing a large amount of dedicated research time. Almost 2/3 of a fellowship will be dedicated to research and allowing you to explore that area. And that means that all your peers, if you're already a physician scientist, still your peers will be engaging in scientific development and education alongside you. The scholarly work, again, through the ACGME is to pursue hypothesis-driven science and inquiry that results in contributions to medical literature, probably not the most important, but also to patient care and improved outcomes, which obviously very important for pediatric science to be translatable and implementable. So here's just the brief part about the training pathways. The American Board of Pediatrics appreciates that we need pathways to help people integrate science into their training so that training doesn't just become an infinite loop of more and more years, and that we dedicate time to enable people to become scientists while also still becoming excellent clinicians. So there are actually 2 pathways in pediatrics, which is twice as many as there are in internal medicine. So PhD training prior to fellowship is not required for entry into these programs. That may vary by the program that you're training at, and different programs have different internal requirements to participate in these programs, but the board and the ACG themselves don't have an entirely specific requirement that can't be overcome. But it does need a very strong commitment to academic goals. So you have to be very clear about what it is you would like to accomplish in the future in order to engage in these pathways. And they're known as the accelerated and integrated research pathways. The IRP, the integrated one, does also need approval from the board for entry, and that has to happen during your intern year. The ARP historically has only required an announcement. You also still have to tell the board, but you don't have to go through as much of an approval process. And you don't have to do these pathways to become a pediatrician scientist. Regular categorical training can also lead to a physician scientist career. I think that's important to remember. So you're not missing the boat. Like the boat has not left you at any point along this pathway, which is why I had that exciting diagram earlier showing you all the different ways you can arrive at being a scientist. So just in short, this is the accelerated research pathway. It puts an extra year of research here in the fellowship. And this is the IRP. It puts the extra year of research here during the residency, up to 12 months. So you generally do a 2 to 3 year residency. This is the proposed, not fully approved yet, but the most likely future requirements for training in pediatrics. It's probably not that important to you at a detail level, but what is sort of relevant is that if you're going to do 2 years of clinical training, almost all of your weeks are spoken for now. So if you can imagine, you went into the ARP, where you're going to have 2 years of residency and then 4 years of fellowship. You need to match into the residency somewhere in your second year, which means you need to kind of be applying at the end of your first year, which means you already need to have decided. And if you don't have a whole lot of elective time, so you cut out a year of training, you basically get 4 weeks of electives now in this new model. There may not be a lot of time to think about it. whereas the IRP might have a little bit more time that you could structure in there to give you more time if that's what you need. So these are good things to be thinking about now as you're moving through the end of medical training. But the pathways are both great. You might consider what programs offer or are familiar with if you're choosing them. You might think about your certainty about your fellowship field and your desire for 2 or 3 years of general experience. But you can really have it your way, right? Do ARP, IRP. You can also take extra time other ways. So Dr. Chahroudi is going to talk about the R38. There are foundation programs. Dr. Satlin is going to talk about the PSTP. There's also many other programs that might support time off. But really the message I'd like for you to take is that time invested in you by programs and by you through your efforts is the primary determinant of your future success. So find the time to engage in the things that you're passionate about. Pass it off to Dr. Chahroudi to talk about the R38, yet another exciting way to expand your research experience.
Sorry, I couldn't see how to unmute once I shared the screen. You'd think I never did this before. All right. So here are the slides. Okay. So yes, I'm going to jump right into talking about the R38. So this is an NIH grant that still exists, and they just put out a new request for application. So that's exciting. Or that it's the Stimulating Access to Research in Residency program, or STAR program. So the purpose of this, as it's stated in the request for applications, is to recruit and retain outstanding physician investigators. And really, the original goal of the R38 was to actually provide extended research training in residency for those folks who might not have had a PhD or had significant amount of research training prior to joining residency. I think that the way that the program has worked out, it may not necessarily always be people who are kind of, completely fresh to research. People have joined that have maybe taken a year or two off and done some research in between undergrad and medical school, or maybe done some, more extended research in medical school, because that you do sort of need to know that you want to pursue this pathway. So the important thing about this is that it's the mechanism, it's an award to the institution. So it's not something you would apply for as a resident or somebody, applying to residency programs. And so really you're looking for if this is an interest to you, you're looking for institutions that hold these grants, and those are easily searchable on NIH Reporter. And I'm sure during your interview process, many people will talk about them. And so the overall program provides mentored research opportunities for resident investigators for a minimum of 1 year and a maximum of 2 years during their residency training. And this can involve an additional year of pediatric residency, so doing 4 years rather than 3 years. And there's a number of different NIH institutes that are participating in this program. So what it does is it provides support for your salary during that research portion. And so that's kind of taken away from the way that the clinical part of your residency salary is funded. But more importantly, it provides supplementary research and professional development activities. And each program is slightly different, but they all offer, research supplies and technical support, registration and materials. I won't read through all these things, but basically a lot of additional support that you need to accomplish your research goals. And unlike not I think exclusively, but unlike many of the research and residency programs or PSTPs that are not grant funded or foundation funded, this actually gives you a good chunk of money to do your research itself. And so these are the different components. There's a program director. I'm our program director here. A lot of them are combined across residency programs, so you might benefit from, meeting other clinician investigators in internal medicine or pathology or surgery, et cetera. it's very intertwined with the residency. You are, propose a hypothesis-based experimental research program. The board approves the plan. And then there's lots of different workshops, boot camps, et cetera, and ways of addressing research competencies. Lots of career development. So it really kind of provides a big guide to your research training in residency. And then people who participate in the R38 are eligible for a special 2-year K award called the K38. And that is only, open to folks who have done the R38. And it has a very good track record of funding for the applicants. I'm not going to read all of this, but this is sort of something, some figures that we created for our program, and kind of shows how you sort of have the core curriculum, you have your individual research training, your mentored research project, and then you're able to kind of compete for your extramural funding and submit those career development awards at the top of the pinnacle of your residency. And the whole idea is to help you, while you're learning to be a great pediatrician and kind of figuring out what the next step is in terms of applying for fellowship, or, transitioning to a next job, you are intertwining research with your identity as a pediatrician. And that allows, I think, people to not feel like, oh, research is this thing I do on the side, or research is this thing that takes away from my ability to see patients. It's really trying to foster an intertwined approach to research and clinical activity. So this is an example of how in the bottom is in the orange kind of outline is how we have done the R38 here at Emory, and ours is a joint pediatrics pathology program. So you don't do any, research in the first year of residency. So, and this is, you can kind of design it to how it best fits your project, which is really nice. But sort of here's an example of doing 3 months of research during your PGY 2 year, 6 months in your PGY 3 year, and then a research chief year, PGY 4 of 9 months. So that, gives you the total 18-month period. You can then transition on to fellowship, but that's not a requirement of this program, unlike, for example, the ARP that was just discussed. And as Dan said, you can train to be a pediatrician scientist through the categorical or general track, through the IRP, integrated or accelerated. All of those are opportunities, as well as the R38. And I'm just going to take 2 more slides to deviate slightly, but since this is partially sponsored by the Society of Pediatric Research and I'm the strategic strategy and operations officer, I just wanted to introduce it briefly to everybody because I'm not sure that I don't think I really knew what it was sitting in your shoes, but it's a great organization. It's an honorific organization for faculty who are applying for it, but it's very focused on early career development and research. And so you can see the vision and the mission and the website there. And we do have a what we call E2E section, or emerging to established. And this is free for folks to join. You have to be in residency to be eligible. So you look ahead just, a short while for most of you. You can join at any time. So it's, the regular standard SPR membership is an annual call, but this you can join. It's rolling admission, self-nomination. It opens up a lot of opportunities. So I highly recommend that everybody take a look at it and consider it once you start your residency in pediatrics. All right, I'm going to stop there.
Great. And now it is my turn, but I need one of the 2 of you. Dan, are you able to share my slides? Thanks. So what I wanted to do was just spend a few minutes talking about the Pediatric Scientist Development Program. I'm sorry, my little kitten, my brand new kitten, is really interested in this part. This is a program that is run out of Cornell. Sally Permar, who's a colleague of mine just down the block, runs this program. If you go to the next slide, Dan. Um, the goal of this program is just very similar to those you've already heard. We want to develop the next generation of pediatric scientist leaders. And this program is a collaboration between NICHD and the Association of Medical School Pediatric Department Chairs, AMSPDEC. So I've been very involved with this program and also the research committee of AMSPDEC. The goal is to support the development of early stage pediatric scientists who are pursuing any sort of research. And notably, this is a program, as you'll see in the next slide, Dan. I believe it's the next slide. This slide actually just identifies the different supporting agencies that provide money for this program. Next slide. This is a program specifically for those who are beyond residency. Typically, this is a program for the late fellowship to early faculty career years. The goals of the program, again, to address problems central to child health, and to address the declining number of trained pediatric physicians who go on to become independent scientists. What the program does, it provides 3 years of mentored research training with 80 to 100% protected research time. And it's really it's targeted to the later stage of training, specifically to prepare fellows for research careers in academic peds. Next slide, please. The funding model is that the PSTP scholars are funded in their 3rd year of fellowship and in their transition to the faculty year. So those would be the PSTP years 2 and 3. So the PSTP year 1, which is a 3rd year fellow, is funded by the scholar's home institution, and then the subsequent years are funded by the PSTP, where you can see, like for this year, the program supports $82K in salary and fringe. In addition, the scholars get $20K in research funds and $5K for travel in years 2 and 3. Scholars can take their awards to another institution during their 3rd year, which again is a faculty year. Next slide. So what makes you eligible for this program? You have to have be completing or have completed a pediatric residency in the US or Canada and be pursuing a pediatric specialty fellowship. It's open to pediatricians with any one of the degrees listed there. And in fact, you can think about this as expanded criteria now that include those who wish to pursue research later in their fellowship. So again, you can, as Dan began, you can become a physician scientist, even without the PhD. You can make the decision late. Granted, most of the APSA members are MD PhDs, but for those who may on the call or on the at the webinar who are not MD PhDs, there are many options to become a physician scientist. Next slide, please. PSTP scholars benefit from many, many different forms of mentorship. There's a local scientific mentor, the PI of the lab, typically. There's an external career mentor from the PSTP steering committee. And these mentors typically stay with a trainee for a while. I still mentor a number of past PSTP trainees who for whom I served as the external career mentor. And then there are many other formal and informal interactions with the scholars, including the attendance at the Frontiers in Science meeting that is supported by AMSPDEC. Next slide. And the track record for PSTPs in securing funding is really outstanding. You can see on the left that the total number of NIH funded and K award recipients for the PSTP over 30 years, with about more than half receiving NIH funding and 40% as K award recipients. The K to R conversion rate is really quite excellent for this group, as shown on the right. And in terms of applying to the program, you would apply as a PGY 3 or 4. It's early for most of you to be thinking about this, but you would apply 15 months before you have at least 3 years of 80% research time available. So again, that could be, in your a PGY 3 or 4 year. So again, this program is run out of Cornell. Just tuck this away in the back of your mind. It's for the future for you. But again, I think what you've heard from Dan and Ann and with this program is that there are multiple programs available to help each and every one of you transition to a career as a very successful pediatric physician scientist. So I think we'll end there.
That was wonderful. Thank you so much to our panelists for sharing your time and wisdom and advice with us this evening. We're very grateful for your perspectives and mentorship that you're offering. We're going to transition to breakout rooms where you can connect directly with each speaker. There should be a selection of breakout rooms that pops up at the bottom for our attendees. You're welcome to choose a room or to hop around rooms and move between rooms and ask questions as you like. Feel free to unmute yourself and speak with the panelists. Yeah.
We're currently in breakout rooms. Let me know if you need me to assign you to a specific room.